move the neck in such a way so the SCM comes onto my fingers. And now I reposition the neck more in a neutral position, and now I'm right onto the anterior tubercles of the cervical vertebrae, and my vector of force is posterior. Now I'm just going to press back or posteriorly onto the anterior scalene. Okay? And once I reach the edge of the SCM, I'm going to feel a slight resistance, then I can just slowly ease off. To make sure that you are on the anterior scalene and not on the posterior scalene, you could use the pulse of the subclavian artery. Don't know if you can see the, actually, it's a very, very subtle pulse right here. On the medial side, you have the anterior scalenes, and on the lateral side, you have the middle scalene. So if you're able to locate the pulse, you know where the anterior scalene can be located in the middle scalene. This is a semispinalis technique. And often we focus on the upper trap, levator, even splenius cap. We forget about the semispinalis capitis that follow the spinal groove of the back of the neck. So a good way to get to them is simply move the major muscle in the back of the neck and grab them, and then with your fingers press anteriorly on the posterior transverse processes. Invite the client to tuck their chin in, and you're just going to slowly move up and down along the transverse processes. This usually feels amazing and really helps to release the left side of the neck right now. And I will do the same thing on the right side of the neck. Remember to invite the client to tuck their chin in to bring the transverse processes to you, so we're dealing with a stable neck in this technique. Make sure that the skin is stretched away from you. Position your finger just lateral to the bicipital groove, and then you're just going to move the humerus in lateral rotation as you're massaging that portion of the muscle. A lot of the time that portion is the one that needs the most attention with the pec major. The client might feel it in the deltoid, but that's fine. As long as you're are on the pectoralis major, then you're fine. Okay? Tuck your chin in. Tuck your chin in. So once you located the top of the crest, you're going medially and then pressing towards the crest. Once you found the muscle, then you just simply pivot on the spot to press the QL towards the spine. It's kind of a stripping of the muscle. Super effective. If you want to add a twist to it, you would simply ask the client to drop their left hip away. So they would just drop the hip this way as you are massaging the QL. Let's try that together. Drop it. Here we go. So that creates a lengthening of the muscle in a more deep treatment. So we're going to start with using the joint to expose the muscle. So I'm bringing the hip in lateral rotation, and I'm just going to lean onto the lateral side of the hip, or I could start on the IT band. Okay, go anterior to the greater trochanter. Now from this position, you're going to bring the hip back to bring the muscle to you. You're on the glutes, and then just stay and reach below the ischial tuberosity to include the hamstring attachment. And you do this several times. So we're going to invite the client to just bring the foot up. So it's basically elongating the muscle as I would compress the muscle. So go for it. Okay. And again. All the way up. I highly recommend you asking the client to simply pronate their forearm and keep the forearm in this position as I'm trying to supinate it, and I'm going to feel the belly of the pronator teres right here. So I know exactly where the muscle is, so when I massage it, I know where to go. So I feel the belly, okay? Then I see where the insertion point will be, and the origin will be on the medial epicondyle. The clinical relevance of massaging this muscle is that it's often involved with professions that requires a rotation of the forearm, but also a tight pronator teres can at times impinge the medial nerve that passes